Good afternoon, everyone. I hope that you all had a relaxing Easter weekend and have enjoyed some time with those you live with, or if you were on your own, that you had remote contact with loved ones. I would like to start by thanking the Lord Bishop for coming along yesterday to share some thoughts with us on Easter Sunday. Turning to the figures for today, the total number of tests now undertaken is 2,030. Those tests we have come back are 1,971, so we're awaiting results of 59 tests. From those, we now have confirmed cases of 232 in total, and the total presumed recovered is 131, which leaves us with active cases of 99. And there are also currently 13 hospital admissions of positive cases, and we are awaiting results for 15 other patients that are within Nobles. Before I move on to the main part of the briefing today, I would like to add both mine and the Chief Minister's tribute to Richard Lloyd, the second person on our island community to die after contracting COVID-19. A richly personal tribute was paid by the Chief Constable on Sunday. It would be hard, if not impossible, to surpass anything that the Chief Constable said. Richie's death was the saddest event in the Chief Constable's 36 years in policing, and the tribute will have touched many who heard or read it. Richie embodied the values of public service and community spirit. He not only played a full part in the community, he spent a large part of his life serving it. We have lost a very special person. Another light has gone out in our small, close-knit community, a light that can never be rekindled. But we must continue to fight this wicked disease that has now taken two of our community from us, and let's honour their memory by remembering them each and every day, and reminding ourselves why we need to continue, no matter how hard it may currently be, to ensure we comply with the rules that are there to keep our community safe. Celebrating Easter or anything else, birthdays, anniversaries, or milestones of any kind, is strange and difficult within our current limitations. It is hard to live within these restrictions, especially at a time when we want to be with friends and family and share this spring festival. But we are becoming adept at finding our way around difficulties and coming up with new and imaginative ways to do things we enjoy. It was good to see many examples of this being shared over the weekend. People have been joining choirs from their sitting rooms, worshipping, playing games with people from a distance. I even saw a decorated Easter egg competition being judged online. In the glorious warm weather we had on Friday, many people captured stunning images while out for their daily exercise on our beautiful island. It was lovely to see those being shared. I, for one, have seen pictures shared of places that, despite being Manx born and bred, I have yet to visit, and like others, I am noticing nature around me like never before. The vast majority of people are sticking by the rules, staying at home, maintaining social distance, making essential journeys only, and limiting themselves to a walk or a bike ride once a day. It seems to me that the overwhelming majority of the Manx public have got the message and are sticking to it. To all of you, thank you for playing your part in keeping our community safe. We are aware, however, that there is a minority who don't think the law applies to them. Well, it does. Your irresponsible and reckless behaviour is being called out, and you will be brought to book. Quite simply, you are endangering the health and well-being of others in our community, and we will not tolerate this. We will not let you undermine the hard work of the majority of our community who have made great personal sacrifices in order to help us contain this virus and protect the vulnerable in our community. The other topic I wish to address today is repatriation. You'll have seen the statement issued by government on Saturday, giving more details of our plans to bring home Manx residents who didn't make it back before the borders closed. This process isn't easy. placing restrictions around the freedom of others and requiring health checks as a condition of coming home is not something to be done lightly. We have never done anything quite like this before, and the protocols around our actions must be clinically sound as well as logistically doable. I certainly never expected to be standing here as Health and Social Care Minister supporting the mandatory quarantining of returning members of our community, and I hope no Health and Social Care Minister will ever have to do so again. The system we are putting in place is designed to protect island residents and ensure the efforts we have all made to keep our island safe are not compromised. It is hard, and I know the process around mandatory quarantine proposed has upset and worried many. But we must ensure the safety of everyone in our community, including those who are returning. Anyone who regularly watches these press conferences will remember the graph I displayed showing how our journey in fighting this dreadful disease is going and the risks to our health and social care service and community if we do not follow the path that we have set. Many have asked, why can returning residents not simply self-isolate at home? The medical modelling is clear and clearly shows that if even less than a handful, and substantially less than a handful it is, of returning residents of the 400 we know about were asymptomatic and breached the quarantine at home, with the way the virus multiplies in the community, that could lead to a double bounce effect, resulting in over 100 additional cases on top of those cases we are already expecting in just 1 week. And after 2 weeks, with the way this virus multiplies, even using a worldwide low multiplier for this virus, it would exponentially increase in terms of additional cases, causing serious issues for our health services and our ability to cope with demand. It is therefore absolutely essential that returning residents are managed in a clinically safe way. Otherwise, as per our medical modelling, we risk exposing our community to a second wave of this dreadful virus that would put our case trajectory onto a similar track to that of Italy's, and just those few extra cases a day would result in the blue curve that was shown on the graph. So yes, the quarantine does sound harsh. Yes, it will cause upset and heartache, but it is necessary to ensure that all of the hard work that has gone on to date to protect our community is not undermined. There are to date, as I just stated before, roughly 400 people who have requested to come back. We will bring them back in groups. The first sailing is due on Wednesday. A small group of dedicated staff from different parts of government have brought this plan together with clinical input, and I will update you on this further at a future briefing. Some people will no doubt be disappointed if they have to wait. While I understand they are desperate to come home, we have a system we have worked hard to get right, and we must stick by it to ensure our community can remain safe and we can control the spread of this disease that has already taken lives. Everyone will get home if they meet the criteria, but they can't all come at once, and it must be done in a clinically manageable way. We must continue to flatten the curve, prevent a surge in demand that could cripple our health and care services, and to ensure we do not undo the good work we have already collectively done. Preservation of life is our number one priority, but of course there are other considerations very high on the agenda. These include reviving our economy and restoring some semblance of normal life to our community. We have looked at every scenario, and again with input from our clinicians, been looking at what an exit strategy would look like, taking a risk-based approach sector by sector across our internal economy. However, we need to ensure that any measures taken do not allow this wicked virus to take a greater hold on our community. And it is important for us to understand where we are in the curve of this outbreak, and that data is still being examined. All of the measures we have taken are under constant review and will remain so. And we hope to be able to share details of our next steps shortly once the data has been fully collated and clinically examined. And I will now turn to questions. And first up today, I have Sam at Isle of Man Newspapers.
Good afternoon, Mr. Ashford. How are you?
Good afternoon, Sam. I'm very well.
That's good. I just wondered if we could get a quick update on the Chief Minister. How's he doing? Is he recovering well?
The Chief Minister is recovering well. His symptoms have been mild, which has been the continuous cough and also a fever. His fever is now broken. I had a conversation with him last night. He chaired Council of Ministers this morning, virtually, of course. All our meetings now are online. But he chaired Council of Ministers this morning, and he is rapidly returning to his usual self.
That's good. So I think I'll start with you said about exit strategy. Obviously, this has become the sort of buzzword in the UK at the minute. And we've had a question from one of our readers this morning asking, in terms of, you said about the managed stage to reopen, how far realistically do you think we are down that? Are we looking potentially towards the end of this month, or are we looking further over the hill?
It is still too early to say, Sam, to be perfectly blunt. We need to analyse the data. And as I just said there, everything has got to be done in a clinically managed way. What we've got to ensure we avoid, and this was mentioned at the UK press briefing yesterday, is this reopening things only to find the virus then spreads much more rapidly and you end up back where you started. So what we will be doing is we will be looking at the economy sector by sector, the risks that are involved. We'll be asking our clinicians and public health to have an input into that, and everything will be done in a risk by risk sector by sector managed way. At the moment, we're still analysing the data on where we are. If anyone's following the daily graph that is up on the website, they will know that green line, which is where we are, is verging between the blue and the red, depending upon which day you look at. And we do need that time just to get absolutely certain where we are in our curve. So we've got that reassurance that any actions we take aren't going to put our community at risk.
Okay, just secondly, we've had people who are off island and looking at returning, who are just wondering in terms of the actual process for them. They're wondering about whether, say for instance, will husband and wives be able to stay in the same room, and how will families be split up, and the actual process for how they get off the boat here to the hotel and what actually happens to them. And it's just something that they're concerned about, that they're not getting that information. Whereas they may be travelling this week and they still haven't been told what is actually happening.
Well, hopefully I can give some reassurance around all of those points. Firstly, families will not be being split up unnecessarily. Husbands and wives can stay together as a family unit. In terms of transport will be provided for them to the hotel. So hopefully that will give some reassurance. And we've got Amanda from Jeff the Mongoose.
Thank you, Minister. And can we please pass on our condolences to the friends and family of Richie Lloyd? And for our question, a union has advised nurses not to treat coronavirus patients if they don't have adequate PPE. We've been contacted by a frontline nurse who's expressed serious concerns over PPE availability. She said they are receiving small rations with no explanation as to why. Can you give us more detail on your strategy for distributing PPE?
I most certainly can, and I'm happy to do so, Amanda. First of all, there is no shortage of PPE. I need to make that absolutely clear. The island has been buying in bulk from around the world, as well as through the NHS supply chain. So we do have a large stock of PPE. We've seen, of course, the video footage that I think was shown at the end of one of these press conferences about the work that's been going on at the NSC, where supplies are held. But there is very clear clinical guidance as to which PPE is used and when, and what is appropriate for different settings. So what that means is PPE is being released to the different clinical settings as and when they need it. That might be a scary thing for some on the front line, because the process in the past has basically, I don't want to really use the phrase free for all, but people have been used to the fact they can just turn up and take whatever they require from stores at any given time. There is a much more clinically regimented process now around the use of PPE to make sure that it's being used in the correct way and also in the correct environment, so that the people who require different levels have got that level. So that, I think, is probably what's caused a bit of people being disconcerted. The fact that they were used to just being able to sort of help themselves. they now can't. We are releasing it in batches, but I need to be absolutely categorical. There is no shortage of PPE. We're not experiencing some of the issues that have been mirrored in the UK.
Thank you very much. We've also had a lot of messages about the repatriation emails sent from the government to those wishing to return to the island. Although the situation is, of course, complicated, is the government giving consideration to the tone of the communication it is sending? Those stranded face their own stresses and tell us that more empathy would be appreciated. What is being done to review the tone of the correspondence sent to those trying to come home?
Tone is very important in everything that we do as a government. Sometimes we will get it right, sometimes we'll get it wrong. The same with any communication. People are under an awful lot of stress. As I said in my opening remarks there, a lot of the process may look harsh, particularly the quarantining bit, with a lot of people who just want to get home. They just want to get back to their ordinary lives within the community, and they're stranded abroad in some cases through no fault of their own. They just couldn't physically get back before the border closure. So we do understand the stresses and strains people are under. All our correspondence is constantly reviewed in terms of tone and what we're sending out. This is, of course, the first batch, so we will have things to learn from that. But what people have got to understand is this has got to be done in a clinically managed way, because as I explained, if we get a second line of infection into our community, we've planned for the existing infection rate in the community, and at the moment that's at a manageable level. But if we got a second line of infection into the community that doubled the cases, and we know with the exponential growth of this virus how quickly that can happen, that would overwhelm our health system. So although a lot of what we're doing may seem harsh, it has had full clinical input, and it is the only way that we can get people back in a managed way. So yes, there will be a lot of heartache, there will be a lot of upset, and there will be a lot of worried people out there, and I fully acknowledge that. And as I say, I hope that in years to come, none of my successors as Minister for Health and Social Care will ever have to stand at a podium and make the announcements that I've been having to make over the last few weeks. It's absolutely heartbreaking.
Thank you very much.
Next up, I have Tim, Manx Radio.
Faster my Minister. I've just been outside during the minute and an incredibly moving tribute to David Corkish and Richie Lloyd being paid down here in Arbury as both the parishioners down in this neck of the wood. And a question I've had throughout Easter, and I'll revisit it, is the postcode breakdown of where cases are. People are crying out for that.
Yeah, at the moment, Tim, and that is being worked up and it will be going public. But as I said, we can only do it on the 3-digit postcode. So it'd be the IM1, IM2, IM3, IM4, etc. We can't break it down more than that. In terms of that, at the moment, I can say exactly and emphasise again what I've said at previous press conferences. At the moment, the density of cases is around density of population. There is no cluster points being identified as yet that would say there is a particular area of the island that's a concern. The density of cases at the moment seems to be reflecting the density of population. So as I've mentioned before, the postcode with the highest density is IM2, but that's not unexpected because it also has the highest density of population.
And revisiting another topic is, of course, cloth face masks, and we've seen the advice in Jersey has changed this weekend. Czech Republic, another country that are changing their advice. Are we looking to review wearing a face mask while out in public?
We have reviewed it. We have also looked at the recommendations of the World Health Organization, and we are following those. And the World Health Organization is still quite clear. They reviewed their guidance only very, very recently in the last few days, and it is very clear that there is no benefit to wearing a face mask unless you actually either have COVID-19 or you are caring for someone who has already been diagnosed for COVID-19. What we've got to remember is with face masks as well, they are only of any use whatsoever if they are actually applied and removed clinically in a clinical manner. So that means you don't touch the fabric of the front of the mask, because if you touch the fabric of the front of the mask, you've potentially contaminated it. and that you remove it the same way via just the strings and you dispose of it clinically correctly. If anyone isn't doing that, then the mask is of no use anyway. But one of the interesting things is there is a study that looked at masks, and it actually found that people who were wearing masks were more likely to touch their face than people who weren't, which I found quite an interesting study. But also, if you delve down into the details of all the countries, which I think now is about 203 that have had COVID-19 cases, some do have cultures of wearing masks, others don't. But certainly there seems to be no evidence that wearing masks affects what the human-to-human community transmission rate is. There seems to be no difference between those cultures where masks are prevalent and those cultures where masks aren't. So it suggests on the raw data that it doesn't actually have any effect in terms of community person-to-person transmission. Okay, I've got Rob at 3FM.
Good afternoon, Minister. I hope you had a pleasant Easter weekend.
There was enough to keep me occupied, Rob.
I'm sure. First off, we'd also like to extend our deepest condolences to the family and friends of Mr. Lloyd, obviously following the tragic news this weekend. We really do wish them all the very best. Firstly, we've had another warning this morning from the Office of Fair Trading about scammers trying to target residents and businesses with either fake or low standard healthcare products such as masks, gloves and hand sanitizer. To your personal knowledge, how big is the scale of this issue on the Isle of Man specifically?
Well, I've only become aware of it in the last couple of days, and can I start by saying I find it exceptionally disappointing that at a time when people quite rightly are going to have fears, they're going to have concerns about the spread of this virus, that people would try and take advantage of that and actually try and make money out of it effectively. I think it's absolutely disgraceful that anyone would even consider doing something like that at a time when our community is battling this dreadful disease. In terms of widespread, I believe there's certain people who've been contacted. I don't believe it's massively widespread around the community, but what I would say is, as with any of these things, people should only ever purchase from trusted sources. Unfortunately, there is always going to be a very small minority who will try and take advantage of a situation. But I think that those people in these current circumstances should be absolutely, utterly ashamed of themselves. And if they are caught, then the full weight of the law will be brought against them.
Thank you. My second question is also on the law-related side. The police have kept the public updated on the amount of reports of social distancing breaches over the weekend, and I think it was the Superintendent Bibby said between Good Friday and Easter Saturday they responded to nearly 100 reports of potential social distancing breaches. If, for example, someone is found to be in breach and they're held in custody, that number could rise depending on the amount of reports they get. How many, and I hope maybe you can provide a specific figure, how many cells do the police have available to deal with COVID-19 offenders before there's so many that it could actually impact what the police are doing in line with how they respect social distancing measures as well?
Well, I mean, I don't have those figures. That would be something for the Chief Constable to answer in terms of the cells. But what I would say is most social distancing offences, if they are a first offence, can be dealt with via a warning from the police, which the Chief Constable explained when he came to the press conference last week. It is only then if we start seeing the same people time after time, and I did allude to it in my speech, that there are unfortunately a very small minority who seem to think the rules don't apply to them, then again, as the Chief Constable made absolutely clear when he stood at this podium last week, the full weight of the law will be brought against them. Most social distancing offences are one-offs that can be dealt with via warning or the existing there, but those that continuously try to breach it, they will find themselves in court. In terms of people being held in custody, so the numbers I would expect in those terms will be quite low, because it will, I would imagine, be the serial repeat offenders that the Chief Constable alluded to when he was here.
Okay, thank you.
Next up, I have Paul.
Hello, David.
Hi, Paul.
The usual thing here, trying to put some, facts before the audiences, because everybody is seeing things on the internet. Can you confirm or deny the ICU is now full? 6 ventilators were in use, 2 only left. And of course, on that same basis, you made a pitch that you're part of NHS England and they've had a delivery of ventilators. Have you had any? Are you expecting any, etc.?
Right, in relation to ventilators, it's not true that we're full. And plus the fact, working off the figures you just gave there, that would mean ICU was 8. As I pointed out at the press conference last week, we've actually doubled our ICU capacity and it's now 16. We have all the ventilators that we need. One of the important things I need to emphasise is, again, and I think it's not been helped by the international media's fascination with ventilators, not all patients in hospital require ventilation. It is only those who are the most severe cases with serious breathing difficulties. Most require just a nose cannula oxygen therapy. Some require mask oxygen therapy. Others don't require oxygen therapy at all, just require monitoring. So it's not the case that anyone who's in hospital seems to be, it requires oxygenization or requires ventilation. And I think that's very important to emphasise, because some of the posts I've seen on social media over the weekend assumes that when I read out the hospital numbers, that's the number of people that require a ventilator. It most certainly isn't. I can say right here, right now, in ICU, which is the more critical patients, we only currently have 2 patients in there, COVID-19 patients. So I need to make that absolutely clear that that's not the case. We are not close to our ventilation capacity, and certainly the hospital is not overrun. That's complete falsehoods.
Good, thank you. The Comas Hotel, there's pictures of fencing going up around it. Is that to do with this current project? And what is it to do? Keep people in, out, and also you're presumably going to get friends and relatives turning up there to say hello across this fence. I mean, any more on that you can give us?
There's various logistical works going on up there, including building works. So fencing, I believe, is part of that. We're creating an area so people can exercise, because, of course, one of the key things is we have said people will still be able to have their daily exercise up there. But it is important, and it's got to be remembered, this is a quarantine facility at the end of the day. I made it absolutely bluntly clear in my remarks earlier that, you know, we have to do this in a clinically managed way. And sadly, it is going to cause upset, it is going to cause heartache, and it is going to worry people. But it is important that we follow the advice of our clinicians and the medical evidence and protect not just the people here now, but also those returning residents as well, because ultimately they are residents of the island too. We're all one community, and we all need to ensure that what we do is for the best protection of that community at this time.
By the way, did you answer the question about have you put a pitch in for any ventilators from the NHS England?
Sorry, I should have said we have all the ventilators that we require on Ireland, because it's not just around ventilation as well. What we've got to remember is you've got to have staff trained to use it. You've got to have the space to do it. We have doubled our ICU capacity on the island, so we do have all the ventilators that we require.
Thank you.
Tim, another question?
Yeah. Can I just ask about patient transfers? Because I believe there's some changes across at Liverpool. They're not using the main terminal anymore.
That's news to me, as I'm not aware of that they're not using the main terminal at Liverpool. I know patient transfers, certainly the conversations we had with Liverpool Airport, they would still be coming in and out. They may well have shut the main terminal because they've not got many flights going through, but my understanding is patient transfer flights are still going from Liverpool.
Yeah, they're using apparently XLR as a corporate aviation facility, right?
Yeah, which is from my memory, from the number of times I've been through Liverpool, that's the facility just to the side of the airport. But in terms of patient transfer, we will continue to move people back and forward as required. But again, I need to emphasise we have cut down massively on our patient transfer. It is only those who are really in exceptional need that are now travelling. A lot of consultations are being done either over phone or, as we are speaking now, over video. Amanda?
Government guidance says that children can spend time in 2 households if their parents are separated. Some parents are concerned that this risks too much contamination for their children. Is the government going to retain the blanket rule, or would they consider a case-by-case basis?
Well, obviously, ultimately, it's down to the parents, the agreements they put in place with their own children. The current rules do allow the facilitation of children to move between households, but that is a risk that the parents themselves need to consider and manage. Obviously, if a child is in a house that becomes symptomatic, then that household gets locked down. So when we're referring to those rules, we're referring to cases where it's asymptomatic, where neither household is actually showing symptoms. The rules change if symptoms present, because at that point it would shut down. But that is a decision for parents themselves to make, whether or not.
If the parents disagreed, would that be a case by case basis?
To be honest, it's not for government to be being involved in where children reside. The rules have been set medically, and medically it has been agreed that children can transfer. So government is coming from this from a medical point of view. In terms of disagreements, that would depend on any legal agreements parents may have in place about the transfer of children. That is not for us as a government to be interfering with any legal agreements that might be in place. What we come from is the health point of view, and that is if both households are asymptomatic, then children can continue to transfer as normal. If a household becomes symptomatic, any of those households, then obviously the children have to quarantine along with the household. But it's not for us to be trying to resolve legal disputes between parents. Sam?
I think I'm sorry if this is slightly going back over old ground again. It does feel like some things do. We had a teaching union put out a press release saying that teachers who are obviously staying in school, especially during Easter holidays as well, more likely to be exposed to anything that is going around, and yet they're not being supplied with PPE. What has been done to resolve that issue? Because they're saying they're having problems with the education department. My respect to the health minister, of course, does all transfer around government at the minute.
Right, so in relation to education, I know education's been looking at this. They're aware of certain teachers' concerns. Before I came in to do this press conference, I was speaking actually to the Minister for Education, and I know it's something that's on education's agenda. There is very specific guidelines around PPE, what should be used and where, and that includes the education setting. Those guidelines, certainly from what I've seen, are being adhered to, but the Department for Education is aware of the union's concerns. They're also aware of certain teachers who've expressed concern, and I know there will be a communication going out very shortly from the department to engage with them around those.
Thank you.
Tim and then Paul.
Returning to the repatriation, and we know that people coming back to the island are going to have to pay for the boat and also for the quarantine. Can I ask about affordability issues with regard to that?
Right.
How much is it going to cost?
Right, well, the 1,000 is the maximum cap. That's what I need to say first of all. I know this has caused some concern. Those who are on or would qualify for, so that's the key point, not just those that are on but would qualify for income-related benefits will not have to pay. The same with any student who is in receipt of a maintenance grant. For anyone else, the absolute important point is nobody is going to be turned back because they don't have £1,000 in their back pocket. We will arrange payment plans for people which may be over a quite substantial period of time. We've not gone down the route of the UK as they did with some of their quarantine, where they said it's got to be paid or you won't get your passport renewed and various other things. We haven't gone down that route, so people will be able to repay over maybe a year and a half if necessary, to make it more affordable for them. We are not going to turn anyone away at Heysham because they can't afford the £1,000 there and then, and that needs to be made absolutely categorically clear. Okay, Paul?
This is from a viewer. How many beds are currently available in Nobles? When do you anticipate the restarting of cancer surgeries, chemotherapy and other treatments? And there are patients who have been diagnosed and are waiting for treatment, and obviously it's very concerning for them.
Right, taking the beds first, in total across the whole Nobles estate, I believe the current number of free beds is around about the 80 to 90 mark. In terms of those beds specifically for COVID-19, which is what I assumed the viewer's actually after, in total at the moment, according to my figures, we've got 26 beds occupied across the 2 wards, which would therefore, on my maths, leave 14 beds free. And of course, we've got the 50 beds due to come online on the new build on Newlands as well very shortly. In relation to, so what was the second half of your question, Paul? It was
anticipating the restarting of cancer surgery.
Oh, sorry, yes, cancer. I mean, again, you know, exceptionally worrying times for people. We have had to redeploy staff. But also one of the things that's informed our thinking is one of the evidence pieces that came out of Italy and the way they were dealing with the outbreak is cancer patients in a hospital setting, if they catch COVID-19, the fatality rate is 5 times that of ordinary people. That is something that came out of the evidence in Italy. So it's very, very important that we actually do things on a clinical risk management basis. So that is why, for instance, the UK has basically shut down its cancer centres, because although there are people awaiting treatment for cancer, the risks of them going into a medical setting, and if they then contracted COVID-19, are even higher in most cases than their risks with the cancer they're suffering from. It's been a very difficult decision to make. Again, I know it's caused a lot of concern, a lot of worry, not just for the patients, but their wider families as well, who quite clearly are worried about their loved ones. But it is something we've had to take on a clinical basis because we have had to repurpose the theatre in order to deal with COVID-19 and expand our ICU capacity. We've also need to repurpose staff, but we also need to recognise the risk that if cancer patients catch COVID-19, their mortality rate is 5 times higher than anyone else. So, you know, it's got to be done in a risk-based approach, and the best place for many of those people is self-isolating at home during this difficult time. But obviously, as with everything, we will look to unwind things as quickly as possible and get normal service resumed, but it's got to be done in a clinically managed and clinically led way based on medical evidence. Well, thank you very much indeed. I'd just like to give a couple of quick shout outs for today. Firstly, thank you to Impact Kickboxing, who have been continuing doing virtual training with 200 of their students, ensuring they can keep fit and well at home. To the Friends of Nobles Hospital, who have donated over £200,000 for new ventilators to be used in ICU. Thank you very much to them, that really is appreciated. Colburns, who have donated a tall fridge toward 12 free of charge to support the team. Annika Spa for their great customer service. Jean Norris of Andrea Meats, Andy Corrie and all the team across the co-ops island-wide. Claire Christian of Claire Christian Couture for all the work she is doing helping other businesses. Harding Meats in Onken. First Care Carers for all their efforts for the elderly and vulnerable, and Strang Stores for supporting residents in their area. Today I would like to mention a serving police officer who has moved out of his home to protect his pregnant wife and young child. They are apart so he can do his job as a key worker, but at the same time protect his wife and family. Also, the guys at Friar's Fish and Chip Shop in Onken deserve a shout out. A resident of Onken whose daughter lives in Canada messaged them and asked if she could order a fish and chip supper to be delivered to her mum and elderly neighbour as a Saturday night treat, and they went out of their way to do so. As Minister for Health and Social Care, I'd also like to take the opportunity to say a big thank you to all the staff working across our care homes. This is a difficult and scary time for all of our frontline workers. I know from speaking to someone associated with Retna Bay that from the cooks, housekeepers, carers, all the way up to the managers, they are all going above and beyond to keep their residents safe and well. I know that is the same in all of our other care homes across the island. So thank you to all our care home workers who I know are doing everything they can to keep their vulnerable residents safe. And it really is appreciated, especially at this difficult and unsettling time when I know many staff in care homes will have their own fears, anxieties and worries as well. Thank you for all that you're doing. And thank you very much for everyone, and I'll see you tomorrow.
We're working hard behind the scenes
to provide community services for our island.
From supplying everyday essentials
to maintaining access to important services.
We are teaching the children of the key workers and delivering childcare.
We're keeping the Isle of Man's essential services going.
We've all got a part to play in keeping the island running.
So you can play your part. Stay at home and keep our community safe.
People's lives don't stop.
And neither do we.
Which is why we're providing our community
with what it needs when it needs it.
For you, for our community and our island.
For you, for our community, for all our island.
Hospice care for you, for our community and for our island.
For you, for our community and for our island.
For you, for our community, for our island.